Like Neil, my time as NCAL chair is ending. I will tell you that these last 2 years have flown by in a flash. And as my mother used to tell me, time flies when you're having fun and getting something done. We've come together as never before as an association. Since 2011, NCAL membership has increased by 15% to now over 150,000 beds, and that's across the nation. We continue to fight to ensure assisted living is included as a home and community-based service under Medicaid. This has been ongoing since I became chair and remains our top political issue. Thanks to our strong relationship with CMS and the Hill, as well as our member lobbying efforts, we've been able to improve the proposed definition. And while we wait for the final rule to be released, we're not standing idly by. We're continuing to educate members of Congress to prepare for any potential need for a legislative change. At NCAL, we've made an unprecedented commitment to quality. By announcing our own version of the Quality Initiative, communities all around the country are concentrating on specific goals and targets. NCAL also created a specific AL track for the Bronze Level Quality Award. We developed the first NCAL education event specifically for our NCAL members, the NCAL Spring Conference, and now it's coming up in its third year this year in March in Las Vegas. And more NCAL members are witnessing the value of our educational opportunities. Yesterday's NCAL Day saw record numbers. It's in its 7th year. Members are now participating more in NCAL reports and surveys, giving us a better picture of what's happening within the profession around the country. We've done a lot to be proud of over the past 2 years, not just at NCAL, but as professionals working in assisted living. But I also realize that many of you feel like, 2 years feels like a long time ago. Heck, 2 days feels like a long time ago to me. You're just trying to deal with the million things that crop up every day. Now, I know, I'm going to reach in my pocket here, that none of you have one of these. But I'll bet right now some of you are texting your staff to find out what's going on in your buildings. I know, because I did it when Neil was talking. But don't worry, you're not in trouble. We all have to do it to keep in touch. The point is, we're doing what we need to do to keep our communities going. But if I've learned anything in the 2 years as your chair, it's that if you're not leading, you risk being left behind. The baby boomers are coming. They're going to be demanding. They're going to want choices. They're going to want independence. And they're going to want the latest technology. We must meet them where they are and understand their importance in the customer experience. And speaking of technology, it's not just necessary for the customer. It's going to be a must for the clinical assessments as well. And with the rise of the accountable care organizations, it will mean having that information available to you at the click of a mouse. That's why NCAL is truly excited to announce its National Patient Safety Organization for Assisted Living. In collaboration with the New Jersey Hospital Association. We've been talking about this for a long time, and now we're nearly there. But still, not everyone is familiar with what a PSO is. This national effort includes a group of independent healthcare experts who can collect, analyze clinical information on assisted living and have it available to our members. The members will be able to sign up and submit data on key clinical measures, including 2 of the Quality Initiative goals, hospital readmissions and antipsychotics. Then we can look at trends from the national level down to the community level to gain insights into the underlying causes of patient safety events. We've never had this sort of information for assisted living before, not collectively. It's an important milestone for us. By the end of 2013, NCAL members will be able to start signing up for this PSO. And by the first of the new year, data collection will begin. I encourage all NCAL members to incorporate this into their budgets for 2014. Visit NCAL's website to learn more about how the PSO can benefit your organization. Remember, information is power, but beyond data, we must also understand what's happening with our residents so we can properly respond to their needs. It's not just about offering a well-decorated building for people who don't need skilled nursing. Whether it's taking this virtual dementia tour to understand the disease process or offering more rehab, we need to identify ways to keep assisted living innovative. Myself, I've been involved in assisted living for over 10 years, and its growth during this time has been exciting. But is that enough? Are we satisfied with just more buildings? Or do we want to build something more? Our work is not done. We must continue to find ways to improve ourselves, to reach our customers, and to honor their needs. We must embrace and welcome change. I've thoroughly enjoyed my time as the chair of NCAL, and I've learned so much. But I've also learned that time waits for no one. The future is here. The train is leaving the station. But with NCAL, no one gets left behind. Thank you.